and welcome back to CAPACIT8, the preview. I'm Liz Campbell from the NQPHN communications team, and we're here today to talk about better governance, what that is, why it's important, and how it can help you with your next project. I'm joined by Matt from NQPHN. Welcome, Matt. Please introduce yourself.
Yes, Matt Burrows here. I'm the Executive Director of Health System Innovation and Integration at NQPHN, and I'm also a Chartered Secretary, so this is a topic very dear to my heart, absolutely.
Thanks, Matt. I'm excited to have this conversation because I'd like to learn more myself about governance. So today we're going to talk about what is governance, why is it important, how it pertains to the work that we do, and you're going to share some cool little stories and secrets.
You want to know what a company secretary is, don't you?
It's true. I want to know all the secrets, Matt.
It is a secret, and I was fascinated when I first started studying governance to find out that the company secretary term actually goes back to antiquity, and it's actually the keeper of the secrets. And that's where the term secretary actually comes from. It's a term where someone had to keep the records of the meetings where people had agreed to what they were going to do. And that became the modern term secretary. And in a governance sense, it's the company secretary, or for an association, the public officer. So each company in Australia is required to have a company secretary. They will keep the register of members. They will keep the registered office. And really that's the point. If there's any conversation to be had, any reporting to be done, both the government and the members and the public know that that's the person to go to and the place to go to do that.
You had me at the word secrets, Matt. So let's dive in and tell me, what is governance in a really simple, easy to understand layman's term?
Governance is really how you organise yourself. So think of that word organise. Governance is about good people coming together to achieve something that they all believe in. Now that might be with the RSPCA, for example, and the protection of animals. It might be with Amnesty International and human rights and protecting those who can't speak for themselves. So it's usually people wanting to come together to achieve something. Governance is the way they organise themselves to achieve that. And it is important because in those fields that I just mentioned, you can imagine people are really, really passionate. And they do want to achieve the outcome, but they don't always agree on the way to get there. So by having good governance in place, having yourself organised, having the rules all laid out so that everybody knows what their roles are and how they're going to go about the business, is going to give you a much better chance of actually achieving what you want. And that's really what governance is, how you organise yourselves to achieve that goal.
And you're right, it is important, especially for the work that we do. And you've been doing some work recently around the Thin Markets Initiative. Can you tell us a little bit about that project, the impact that it's had, and how governance has played its part?
Unfortunately, in Australia, we have areas where there aren't that many doctors, there aren't that many nurses, and places where there's a very sparse population, especially in, you can imagine, the country areas, regional, remote areas. So in those areas, you may even have doctors, but it's very touch and go as to whether they can run a successful business. And that's what private practice is, a business. So we call this a thin market, where either the economy is not strong enough, or the population's not there, or the business itself is just on the brink of viability. So we deem these areas thin markets, and the government has some programs to go in and assist to see if we can do something a little bit different, to change it up, to see if we can make it viable and hopefully in the long run sustainable, so that people in those communities can access medical and health services. So a thin market program we've run in North Queensland has been along the Cassowary coast, where we've intervened with Tully and set up Mission Medical at Mission Beach. And we've also intervened with Ingham to set up Cardwell Medical Practice. And they're two examples, different models, of funding, but 2 examples where we've gone in, intervened to take something that was unviable. In Mission Beach, they'd actually had 2 practices close their doors and stop operating. So people of Mission Beach couldn't go to the doctor there in their community anymore. Now they can, and that's the good news. But it's been a journey to get there, and central to that journey has been governance, because it's been a case of not only the people in Tully Medical and Ingham Family Practice coming together to actually agree to set up a satellite practice at both Mission Beach and Cardwell respectively, but it's been working with Queensland Government, with the Hospital and Health Services, both Townsville and Cairns respectively. It's been working with not-for-profit agencies like Health Workforce Queensland, and central to it really has been local government. The Cassowary Coast Regional Council was fantastic in identifying the need, listening to the community, bringing those voices together and really advocating for something to be done. So when the intervention went ahead, the Thin Market program, it was really bringing all of those voices together to work out how we're going to navigate this and actually set up something that's sustainable going forward. And in being sustainable, it needs support from each of those agencies and indeed from the community. So back to governance. How do you actually organise all of those agencies, all of those people to come together? You do it by having really good, sound governance where you've organised yourself, everybody knows what their roles are, everybody knows what the rules are, and everybody knows what part they need to play in achieving that goal of a sustainable health service in what was a thin market.
It's like a roadmap, I guess, so everyone's on the same page. But also with thin markets, the 3 levels of government came together. So there was local, state, and federal. That's right. The federal government was really the banker in the process. They were the funder of that intervention. The hospital and health services were in the Cardwell instance, they were actually operating it using locum doctors out of the hospital from Townsville. So they had a huge vested interest to return it to the community and into private hands. And local government obviously wanted it to work so that their residents, their ratepayers, their community could access services locally and have a good, cohesive, progressive community. That's a really good description of governance, Matt. Thank you. And I'm learning a lot too. Can you paint a picture for us on what good governance actually looks like?
I think certainly, again, in health, it's a human service. So you have to think of values. And I think good governance in our industry has to be inclusive, it has to be accountable, transparent, and it has to have integrity. And that's when people will sign up to it and say, yes, I want to be a part of this. I agree to this is how we organise ourselves. I agree to this rule book, and I really want to be a part of achieving what we've set out to. I think they're probably the essentials to good governance, knowing that it's from a values base. You need to involve people. It has to be inclusive. From the members, whoever they may be, and it can be very informal through to the very formal with a constitution incorporated, etc. But even in an informal, as long as everybody knows that they're a part of something and that there is a way of operating that we've all agreed to, and there's a way that we're going to organise ourselves to achieve that, and we're going to come together every fortnight to meet, that's governance in action. And I think if people can break it down to that very simple, how we organise ourselves to achieve what we've set out to, I think they'll get the gist of what governance is. But good governance itself is making sure that you have the checks and balances in place to be accountable, to make sure everybody knows what part they are playing, and to be transparent about that. When you have a sophisticated enterprise or organisation, your checks and balances, for example, would have 2 people signing a cheque for a payment. That's one that most of us know as just a good control mechanism that you would have in your policies and procedures that all form part of this term governance. So don't overthink it. Just we're all doing this every day, and it all forms actually part of good governance.
And relationships are a big part of that too.
Governance sometimes is how you govern yourself. We don't think of it that way, but it can be how you organise yourself. But more often, it's how people are coming together to organise themselves to achieve something. And it can also be how organisations come together and agree to things. The United Nations is a form of governance where the world has agreed, for the most part, that we're all going to contribute and send a delegate to the UN to talk about how we sort out some of our differences and achieve common good for humankind. That's governance at the global level. You've got governance at the national level with the COAG meetings, which is the Coalition of Australian Governments, brings together the Commonwealth Government with each of the state governments. The Prime Minister meets with all of the premiers. And then you've got governance at a state level, and we see that in health with Queensland Government, the Queensland Health Department, in our area, the Office of Rural Remote Health, Queensland Government again, the Hospital and Health Services, which operate in Cairns, Townsville, Torres and Cape and Mackay in North Queensland. And then you've got a whole range of not-for-profit and NGOs. You've got the Aboriginal community-controlled sector. You've got peak bodies like National Disability Services. You've got organisations operating in North Queensland. So how we bring all of those parties together in governance to deliver good health services to the people of North Queensland. It needs to be open, it needs to be transparent, it needs to be accountable.
Yeah, that's great insight. Thanks for sharing that, Matt. On that note, is there one thing that you wish people would do when they're implementing governance?
Break it down. If you start with a concept that people are unsure of, I don't think you're going to get where you want to be. And it is about bringing people together on the same journey and building trust. So just break it down to those very simple terms. What are we here for? Why did we get out of bed this morning, come together and decide we want to achieve something together, whatever that might be? Now that we've set the why are we doing this? How are we going to do it? And that's your governance piece. How you're actually going to come together, organise yourselves to achieve the why is governance. So if you can break it down to those very simple terms, you're well on your way to achieving what you've set out to do.
I think that's a good segue into the next question, which is, are there any practical tools or resources that you can share that will help people understand implementing governance in their projects and actually where to start?
We've got a lot of concepts that we talk about. You've got constitutions which can scare the bejesus out of people, and it doesn't need to. Constitutions, for the most part, shouldn't come to every single meeting. They should only be used when they need to be used. Once you've got people agreeing on what they actually want to achieve and have an understanding of how they're going to do it, the Constitution only comes out when there's disagreement, really. It's a guidance document. So don't be scared of it. See it as your tool. That's the first thing I would say. I mentioned at the start of the interview that we need to be inclusive of people. So when you're looking at setting out with governance, how are you going to be inclusive of people? And don't just use your own opinion. This is where we talk of this concept of co-design. How do you actually bring people into the discussion so that you're getting multiple lenses, multiple points of view of how you're going to achieve it and how you're going to do it? Your view of how much capacity you might have or someone else might have might be very different to someone else's. So just put your checks in there by getting more voices around the table to actually see how you're going to do it. And in round terms, we call that co-design. Be inclusive. And I think once you've actually done that, be very clear. Try to get rid of ambiguity in what people are setting out to achieve. And that way you can bring different people together to actually achieve some good.
You were talking off air before about a survey that you had conducted and you'd used the word governance. You mentioned just a minute ago co-design. Is the survey a part of co-design? And can you tell us about that?
I think governance is a misunderstood concept, and the word itself is very, very close to that term we use, government. I did my doctoral thesis and I did both a quantitative and qualitative component. The quantitative was surveys. The qualitative was interviews. So again, taking concepts and breaking it down to simple language, think of surveys and interviews. I used the word governance in the surveys, but because I wasn't there to explain it and to prompt people with their experience, I got a very, very low return rate on the surveys. However, when it came to the interviews, because I was there and it was a more conversational type interaction, people said, well, Matt, I got to question 2 about governance and I didn't really know what you were talking about. I was then able to explain it. Oh, that's what you mean. How do I organise myself? Boom. I got wonderful returns on the interviews. So I think, again, it's a term that probably is quite misunderstood or not understood in society, and it doesn't need to be, because at its roots, it's really simply how you organise yourself to achieve the things that you want to achieve. What are the checks and balances you're going to put in place? What are the parameters? What are the rules? Let's go forth, agree on that and achieve some greater good. So in governance, people need to come together, organise themselves to achieve something. In that process, at some point, decisions do need to be made. And I think I've said earlier, it is a values-based process and you need to be inclusive. So I think it's important to make sure people have input to decisions. When they do have input, they understand how much control they have in those decisions, how much input they're actually having, and for you to take heed of that. I think a good set of delegations that clearly shows people what decisions they're making, what responsibility they have, and how much control they have in making that decision is really important. If you can get that clarity around decision making, I think it really serves to help people get invested in the decisions and own the decisions. And that is only going to help you succeed and achieve what you've set out to achieve as a group of people or as a group of organisations. I think as a country we are moving in the right direction. I think there are examples in health with the My Medicare reforms. I see it in the disability sector with the National Disability Insurance Scheme and that promise of choice and control for the individual. And I also see it in the aged care sector. So I think we are embracing this sense of good governance, good, clear decision making, and trying to involve people in decisions that actually impact them. The one thing we're doing much better in this country, I think, Liz, is actually listening to the voice of the lived experience and actually involving consumers in decision making as well. I think good governance really should have a component of listening to the end user. And that's something that I think we are improving on.
Before we finish up, we'd like you to reflect on the interview and the information that's been shared and how you can get excited about governance. And one way we're going to help you do that is with a downloadable that you can go through and take on your journey, on your governance journey. Matt, is there anything else you would like to add?
I think just be open to good governance, be open to organising yourself, be open to reflecting on maybe not having all the answers yourself and the value of involving other people. And once you do start involving other people, you need a good rule book on how you're going to interact with each other. People need clarity of what they're there to achieve together. Best use of your time, best use of their time, multiple views on how you're going to do it. Combine all of that, organise yourselves and put in place good governance. And you'll get there.
Thank you very much, Matt. It's been such an insightful chat with you today, and I hope everyone's taken some piece away with them for their governance journey, and just to know that governance is actually not a scary word, it's actually really exciting.